in our city. It may not be free beer, it may not be college scholarships, but we are creating a Voids for Vaccines program where people can have one parking ticket voided if they come in with proof of their vaccination. It's that simple. The ticket must be incurred before today, because we don't want people going out and thinking they can get a free parking ticket right now. But going forward, anybody who's gotten vaccinations, both doses, and they have a parking ticket incurred prior to today, they can come into City Hall, Parking Violations Bureau, and ask to have that ticket voided. It's that simple. Any questions?
Do they have to be a city resident?
No, they do not have to be a city resident. Any ticket incurred in the city of Albany is eligible for a void.
How far back?
As far back as we go. We go back 10 years of our parking tickets right now. So hopefully this will encourage some people who have backlog of parking tickets to come in and address those as well.
What's the outstanding number of parking tickets?
We have about 90,000 outstanding parking tickets right now overall. And again, that goes back to 2010.
There's an estimated amount of revenue that's...
Overall, it's about $9 million. Yeah, about $9 million. Yeah.
So then what comes through? It's going to cost you $9 million?
Well, no, there's lots of people who have multiple parking tickets. So there's actually not too many people who have individual parking tickets. Most people with a backlog like that have multiple parking tickets. So.
And how many can they get paid?
One per household. Yep.
And it doesn't matter when they got their vaccine?
Does not matter when they got their vaccine. We want to reward the behavior. We want to reward previous vaccinations, encourage future vaccinations, and all tickets prior to today are eligible to be voided.
Do you have numbers now on this point we got it right from the county about the permanent vaccination rate in the county?
Yeah, the mayor can answer that.
So, this is part of an effort to get everybody vaccinated. We want 70% vaccinated by July 4th. And I had a conversation just this morning with Dr. Whalen, and she's going to be providing us with that information. We have it at the zip code level, so we overlap, the city of Albany overlaps with a few zip codes, but we want to be doing our part to get to that goal of 70%. She's going to give us the baseline data this week, and we'll be looking and seeing what type of impact we have. We just want to encourage people to get vaccinated. It's safe, it's effective, it's easy, it's free. So we want as many people to get vaccinated as possible, and we want to be part of the solution. So we're going to be announcing more on that goal of getting to 70%. Our city treasurer and our Common Council president, as well as Dorcia Pleers, who is our chief city auditor, but is also a doctor and has her doctorate in public health, have really taken the lead in making sure that we're doing all that we can to incentivize getting people vaccinated, getting the information out there. The city has funded a number of positions to try to get people information that they need in order to really understand the vaccine and get their questions answered and get people vaccinated. So, this is something that I had asked the other citywide electeds to help with very early on, and they've taken up the charge. And I want to commend our city treasurer for being innovative and for recognizing that this is just one more way for folks to maybe think about, if they haven't found the time to get vaccinated, but they've got an outstanding parking ticket, there's no better time than now than to get vaccinated.
Absolutely.
There have become so many different incentives for people to get the vaccine. Looking at the data, have you seen that any of these pushes have kind of started to make any sort of difference here locally?
It's hard to tell. But I think it has some.
What we're seeing is that, being able to access the vaccine where you are is an important factor. So we have done outreach at the, for example, the South End Night Market, as we do our engagement around the West Hill Community Center. We're going to encourage community-based organizations to be there with information about vaccines. So we really want to get information out to people. People have questions, people have concerns. One of the things that we're encouraging people to do is to talk to their doctor. Not everybody can get the vaccine, we understand that, but most people can. And I think one of the things that is really important for people to recognize is that because there are people who cannot get the vaccine, it's all the more important that those of us who can do.
I also say that if you look at our outstanding tickets in the city, for city residents, it's generally our poorer communities who have a higher backlog of parking tickets. It's also, I think, those communities have a lower vaccination rate. So this is in part to help encourage vaccinations and to get people to address their parking tickets before they get booted. Anything else?
Do we
Sure.
know what the percentages of the vaccination rate in the city is?
So that's very difficult data to get, and not for lack of trying. The county doesn't have all of the data, right? The county knows who they have vaccinated, and they're able to get us that information. But of course, they're not the only vaccinator. The state has been vaccinating in the city of Albany. FEMA has been vaccinating in the city of Albany. We have pharmacies, we have health clinics. All great. I mean, thank goodness for all of the different entities that are vaccinating in the city. But it's broken down by zip code. And as most of you know, we have overlapping zip codes. So some of those are mostly in Albany and a little bit in one of our suburban communities. Others of those are mostly in a suburban community and a little bit in Albany. So we're going to really, we'll go with what we have, and we hope to be announcing our baseline this week, as I said, of where we are in all the zip codes that touch the city of Albany. And we look forward to building from there.
With these incentives, this one seems more less controversial, I guess, because if you have been vaccinated 3 months ago, this still applies to you, right?
Correct.
So some of these are like, get vaccinated today, and then you get the incentive. So because, just what are your thoughts overall on creating these incentives,
Anything helps. I think anything that encourages people to get vaccinated gets us back to normal more quickly. And like I said, it's not free beer, and it's not a college scholarship, but in our little corner of the world, this is something that we can do, and so that's why we're doing it.
You mentioned that this is an issue that the backlog has really impacted those impoverished in the community. How much of a financial help is this? And I know parking tickets to some might not seem like a big deal, but if you don't have the money coming in.
Yeah, it can be. We at the Parking Violations Bureau work with people all the time when they come in, if they have a backlog of parking tickets, to deal with it in a way, may void a couple of tickets and then come up with a payment plan to make those tickets so they can still use their car to get to work. Because it's absolutely a problem of where people have a job and have a car, but don't make a lot of money, and they get the car booted because they have too many parking tickets, and then it starts a cycle of difficulty, basically. We're looking also in the city, I don't want to bury the lead here, but we're also looking at the city, a program where people can come in and do community service in return as a payment for their parking tickets. We're working that out as we speak, but it's going to be a little while. But it's precisely because of our poorer communities in the city that have greater issues with this. We don't want to be another issue, and we work our Parking Violations Bureau with that in mind.
How long is this initiative going to go on for?
This will go on for the foreseeable future. I'd say through the end of the year. We don't have a deadline yet, so we'll have to see how it works out. Thankfully, this is kind of a simple thing to do on our part, so we can do with it as we will.
Thank you.
Thank you.
Thank you.
Thank you.
Good work. Thank you.